over to Fran Kelly. Fran Kelly is a member of Patients Not Passports and going to be picking up on the work and campaigning work that they're doing at Patients Not Passports. Over to you, Fran.
Thanks very much, and thanks for the invite to talk tonight. We've been hearing about people who've been covered under the visa system, and they are working in this country and paying for the NHS through their taxes, and they are all paying twice because they are also paying under the IHS. What I'm going to talk about next or here is the situation of other people who are not covered by the IHS provisions but who have come to this country and are not covered by the protection of being a recognised asylum seeker. I'll give you a very brief overview of the situation, which is extremely complicated, so bear with me. If they need healthcare, those not covered by the NHS can get GP services and primary care free at the point of use if they know it. The big problem comes if they need, or you need, hospital care. Then in general, the government has decreed that you are charged up to 150% of the cost of treatment. Note the parallel with those on IHS who pay twice for their NHS services. Some services are free, for instance, emergency treatment in A&E, but if you're then admitted from A&E, you're charged. TB and COVID treatment is free, but if you think you have them, but it turns out to be something else, then you're charged. So what happens? People don't go to hospital, making this a public health nightmare, and it is truly a moronic policy as well as a murderous one. Maternity treatment, maternity care, you'll get immediately, but you're then charged afterwards. You're also charged after treatment for any condition that a doctor signs off as urgent and immediately necessary. But that situation isn't always obvious. You'd think everyone in the Home Office knows that cancer care should be regarded as urgent and immediately necessary. In Greater Manchester, a cancer patient at the Christie coming from Ethiopia had her treatment held up by the Home Office until the doctors worked out that they had to use exactly that magic phrase, urgent and immediately necessary. I do not know if it was the delay that allowed her disease to progress, but delays in cancer care are bad, and she died. For other treatments, you charged up front. The deterrent effect on people who've migrated to this country is huge. Word has got around that the NHS will charge you, so people don't even go to GPs. People needing hospital treatment don't go to hospital. Some have died. In the case of Simba, a lad in Sheffield receiving treatment for a blood disease, he got a huge bill. He couldn't pay, so he stopped going. He stopped receiving the treatment. He then had a massive stroke. And for the treatment of that, he was presented with a massive bill. He won his asylum case in the end, and further campaigning meant the bill was suspended and withdrawn. But you now have a man in his 30s facing a lifetime in a wheelchair, totally unnecessarily. Women don't go for antenatal care with health consequences. They don't go for follow-ups, even after a complicated pregnancy and serious illness. There are other exemptions from charging. If the person is destitute, the hospital can write off the debt, but that's an accountancy manoeuvre by the hospital, and that's all. It still hangs over the person permanently until that debt is cleared and will be taken into account in their next visa application. One of the conditions for free treatment is that you're ordinarily resident in the UK. Yet Omisha, born in this country and only ever resident, therefore, in this country, to parents who had applied for asylum, ran up a bill of £76,000 when she was treated for liver cancer at the age of 10 months old. Her parents had no right to work. How the hell did they think that would be paid? And that debt hangs over her parents now for when they next apply for a visa renewal. And hospitals use the Home Office to check if they should charge someone. Yet they don't have to use the Home Office to do that. The regulations don't even require it. And they also report debts that are owed. So they have become part of the surveillance state, which adds to the. What can we do, and what has a lot of what I'm going to suggest Patients Not Passport has been involved in. First thing is get the information around about this and the IHS. Raise awareness of its purpose. It's not about money. The government used to collect the figures that they collect of the money they collected in charges, but it was so small that they stopped collecting the data. It didn't work for their propaganda. It is about scapegoating and deterrence. It is about getting in the public's mind that charging is okay, that some people deserve to be charged, and it's about setting up a system for charging all of us in the future. Do all the usual things in campaigning. Approach MPs and councillors, because until the politicians know that this is an issue, and it is an election year, as already has been referred to, until they think it's an issue, they're not going to bother about it. Insist your local hospital write their own leaflet, put up welcoming posters. Don't use the government's horrible and list of what you will be charged for. Make sure the hospitals offer trained advocates through PALS if people need help. And write to the governors of the hospitals and tell them to speak out. We don't think of hospitals as a democratic system, and boy, they aren't. But some of the governors are publicly elected, and they are meant to be the voice of the public and raise public concerns, and that's down to us. Support individual campaigns. Amisha's petition can be reached via the website of Migrants Organise. Unions representing health workers, hi Andrea, can do more. First thing is they can educate their members. A lot of health workers don't know much about this, as the system is run through a small group of admin staff, wrongly called overseas visitors managers. Tell your members the real purpose and effect. Midwives at one local training centre in Greater Manchester had absorbed the government's arguments and saw nothing wrong with charging. And that's even more shocking because midwives traditionally have been the voice of mothers. Give staff the tools to be advocates for their patients, to challenge wrongful charging, and to support their patients through this process. Unions as a whole should join the Paediatric Royal College in condemning the charges, publicly speak out. Stewards need to be equipped to raise the issues with management in their joint negotiating committees. Crucially, I think that the unions should commission King's Counsel for a legal opinion and for arguments regarding the duty of care and health workers' duty to protect their PIN, their registration. If the GMC and the Nursing and Midwifery Council were taking this up as a serious issue, then doctors and nurses would have a chance to refuse to cooperate and to be far more obstructive, whereas at the moment it'd be individually down to them and they would be breaching their contract. A can-do opinion from legal counsel and the unions, at least on a joint basis, have the money to do this, to get this, to show the risk to health workers of registration if they implement any part of these regulations. Would be fantastically useful and in this battle. A joint union approach is crucial, but there's no reason for Unison or Unite or any one union not to go ahead on their own. Can we shift them on this? And that's what we often get thought. Well, Patients Not Passports did shift them at the time of the COVID vaccination. Initially, anyone who was a migrant and possibly of what they would call questionable immigration status was risking facing immigration queries, immigration status investigation, if they had vaccination. PNP launched a huge campaign, and just before the public launch of that, the government did get wind of it and immediately announced that all vaccination should be free and no immigration inquiries should be made of anyone turning up for it. It's a small victory, it's only in one area, but we can defeat this if we make it an issue. Thanks very much.